in the 21st century, I have the ability to take this fat and do some really cool things with this. And this is probably the hottest topic in plastic surgery right now. If you look at this woman, right? She's in her late 50s. She came and she said, you know what? I'm looking old. What can you do? And I don't want a facelift. Now, a facelift's a good operation, but she said, I don't want a facelift. I took the fat and I used it to restore her face. And her grandkids said, Grandma, you look younger. I mean, they're not going to lie. And that was great. So look at her eyes in the before, how tired she looked. Mm-hmm. And then look at her in the after. And you see,
nice.
She had a little bit of skin taken out of the upper lids. But what really gives her that youthful look without doing anything else is that she has these youthful eyes from the fat grafting. Let me show you one other patient. So here's a woman who came to me and she said, I'm 63. I know I look older. I don't want to wear makeup. I just want to go, and I will not have a facelift. Okay. Now, a facelift's a great operation, but she said, I will not have a facelift. And many women come in and say that. And so this is a picture that you can see what happens when you take the fat and use it to restore shape in the face. And when you look at her after picture, she looks better. She looks more youthful, but she looks like herself. The greatest fear is that she's going to look different. She doesn't look different. So if you look at her pictures, look around her eyes. She looks tired, like the other one. She looks tired around her eyes. She's showing the age around her eyes. And I'll tell you, this is one of the most exciting things that I'm doing. And if you look at her after picture around her eyes, she looks rested.
Yep.
She looks better. When people come in and they're scared, they say, I don't want to look different. I want to look rested. When I look at these patients who I've treated, they look rested and they're happy. And they can see that they just look better. Now, look at her mouth. That's even more. Look at her mouth. And if you look at her before, she's got these lines around her lips. Every woman's got that, and they're just so frustrated. She just looks old on her mouth. Okay. After I was using the fat to graft back, to put back in what she lost, you can see that she goes from an old-looking mouth to a more youthful mouth. And you really see when we look at the pictures side by side.
Mm-hmm. Mm-hmm. Now, we are really out of time this time. I want to thank you for coming on the show. So the thing to ask your surgeon is, do you do aqua-shape liposuction?
Aqua-shape liposuction.
And many of your patients, just so we're clear on this, because you say most people would get lipo, but the downtime is too big. You're saying they can drive themselves to your place.
Right.
And have their abs, maybe their love handles, and they drive themselves home. You only numb the area. Is that correct?
So what I'm saying is this. So it is very reasonable to think you have a small area that you can do. You can come in, drive yourself in, have the procedure, 1 hour, drive yourself home. Now, if you're going to have more areas done or more needs to be done to get you the result, then we're going to use anesthesia. And I do all the operating in a accredited operating room that's certified. We have all the anesthesia capabilities. But it's what's going to be best for you to get you predictable result so you can be where you want to be and have a predictable recovery. Even with the bigger procedures, the recovery is still less than anything I've ever seen.
So I want to clarify something. You said in 1 hour. It takes you 1 hour, but they're there more than 1 hour.
So if
at your office.
So let me tell you, that's a great question. So if you drive in, it takes 15 minutes to get you ready. The procedure is 1 hour, 15 minutes, so an hour and a half door to door for someone with a small area like we looked at.
So you could flatten out a stomach and they're back to work, maybe even that day if they had to.
Absolutely.
Is that true?
I have patients. That's true. I have a woman who had this done and she went shopping for the rest of the day. I was like, you're kidding me. So So
this is the next generation of lipo. This is aqua-shaped lipo.
Look, for me, it's better than anything I've ever used. And after doing it for 4.5 years in 300 patients, I can tell you that if there was something better, I would have switched and done something else. But this gets results and gets predictable recovery like nothing I've ever seen.
All right, I want to thank you for coming to the show. Great stuff.
Thanks a lot.
Great stuff. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.